All right, so the lumbar section of this quadrant of the back is going to be a lot like the lumbar section of the back will be a lot like the lamina groove section of the upper body. I'm going to stand in a little bit of a funky way so that you can see me, but it would be a lunge. Do your glides on lumbar lamina groove, erector spinae. And you could do it, again, both directions. And just like we did before, staple and push pin. So find the spinous process, your bony landmark, and then press that spinous process toward the ground. That's the staple move. And then for push pin, you're still in lamina groove using the finger pad. So you can complete that a few times. I'm just showing you one example. The next move on lumbar area is for the QL, the Quadratus lumborum, which goes from the bottom rib to the iliac crest. So this is the outline of the QL. It's deep, 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 deep to erector spinae, deep to some dorsal muscles. The technique in the course packet, I think I say it's like a snow plow when you're pushing and then like a rake when you're pulling. So you simply outline the QL. So I'm going along the iliac crest, up to the last rib, along the last rib, and down to the iliac crest. So you can do that a couple times and then do it in a little bit smaller, so like concentric outlines, until finally you're just kind of in a little circle here. And then you can repeat the whole thing a few times. That's the QL techniques. We're going to switch our body but stay in the same working area. Now our pressure will be down toward their glutes, along the iliac crest, using thumb circles. So just really spending some time on the attachments here at the top of the hip bone. You can do a fist for sure. You could do fingertips. And this will feel great because think about the maternal client on your table. The developing fetus is sitting in her pelvis, and the pelvis isn't just one bone, it's lots of bones. So as the fetus grows, the whole pelvis is changing shape. So the ligaments and muscles and tendons all have a lot of demand on them during pregnancy. This is a common area of complaint. All right, so we've done that quadrant with the erector spinae, QL, and the iliac crest. I think we're done with back, and we will move to glutes. So the techniques listed in your course packet for glutes include compression, again, circular friction. You could do like a chucking or a jostling. The areas that I want you to focus on after you've warmed up the area are the piriformis, from greater trochanter to sacrum. So in here, you can, after warming it up, sink in and do some holds. You can, even with your elbow would be great. And beyond maternal clients, this positioning is fantastic for anyone who needs hip work. I mean, it's just so open and available to you as the therapist. I just love, love, love side lying. So you could also then work both attachment sites, greater trochanter, some friction there. If you have a tool that you're working with, like a P-ball, you could do friction along the sacrum and along the iliac crest. And then the last technique for glutes Side lying is the glute squeeze. My friend Joanna likes to call it the clamshell. So just like this. You're really just getting a lot of that glute max, loosening that up. All right. I think we'll stop there and I'll show you the leg next.